Brewery syndrome. What is Brewery syndrome? Gut fermentation, endogenous ethanol fermentation, drunkenness disease is a condition in which ethanol is produced in the GI tract cavity or the urinary system due to the fermentation of fungi or bacteria after consuming alcohol. Signs and symptoms: patients that develop alcohol brewery syndrome will have classic signs and symptoms of being intoxicated, but they can also have neurological, psychiatric, and respiratory symptoms as well. Signs and symptoms vary from patient to patient. This causes brewery syndrome to be majorly underdiagnosed. The symptoms include mood swings, anxiety, depression, brain fog, seizures, nausea, vomiting, vertigo, runny nose, and cough. Um, these are some of the causes. Bacteria and fungi combine with the yeast and produce ethanol. I can't pronounce the bacteria and the fungi, but this is a list of them. There's a few medical conditions that can cause the person to develop brewery syndrome as well, that being type 2 diabetes, liver cirrhosis, non-alcoholic fatty liver disease, chronic intestinal obstruction, and gastroparesis. Diagnostics for brewery syndrome: so patients that present intoxicated who swear they have not had anything to drink may be suspected to have brewery syndrome. They have to undergo a series of tests and procedures to determine if brewery syndrome is their diagnosis, which this will include family medical history, their medical history, a detailed physical exam. After those are obtained, the patient will need blood work. Then they'll need stool cultures and samples. A carbohydrate challenge is performed, so this test is just where you either eat carbohydrates or something like that, and they test how your body metabolizes it. Then you'll have an endoscopy and a colonoscopy to take biopsies of the upper and the lower GI tract. Lastly, an antifungal and an antibiotic test will be performed to see if it's like antibiotics or anything like that are resistant to it. And then once those tests have came back positive, the patient will move on to treatment and management. Treatment includes just patients who have severely elevated blood alcohol levels will be treated for acute alcohol poisoning first. Depending on the microorganism, patients will be prescribed either an antifungal and a polynine, which is a steroid that targets the fungal membrane. They can or probably will be produced an antibiotic as well as an intracandidine together if the bacteria and the fungus is rare or resistant to any other medication. So that's where you'll go through another series of tests to see if your body is resistant to any of the medications before they prescribe it to you, because some antibiotics can cause your body to produce the ethanol as well when it combines with the yeast. So then, more common than not, brewery syndrome can be resolved by simply changing one's diet. So that would mean cutting out simple sugars and complex sugars, and that cuts down the production of ethanol, therefore reducing the chance of brewery syndrome. Following the dietary changes, you can take a probiotic that will replace any of the bad bacteria with healthy gut bacteria. And then I found this quick little video on YouTube about a lady whose husband was diagnosed with brewery syndrome.
My husband had brewery, which is what led me down this whole path of trying to figure out what it was and how to treat it and all that. And then the next time it happened, I took him to the ER because I thought, this is crazy. And sure enough, his blood alcohol level was 0.334, I think it was.
it actually produces an intoxication, just like if you were drinking alcohol.
Oh, yes, absolutely. Just
Oh,
because
wow.
the gut is creating the alcohol doesn't mean it doesn't get into your bloodstream and into your brain. So it absolutely does. And you actually are drunk. That is the end result.
That is so scary.
My